From a caterpillar to a butterfly, the growth and change of this miraculous creature is beautiful. The same can be said about a little girl who has Turner syndrome. I decided to focus my Pecha Kucha presentation on a little girl whom I've seen grow since birth to a beautiful 6-month-old baby today, and will continue to see her grow into a beautiful woman, my niece, Mila. Since the moment my best friend Ashley found out her daughter has Turner syndrome, she has studied what the syndrome is, how it will affect her daughter, and how it will impact her family. Not having any knowledge of the syndrome, I want to be prepared as I can to assist with her physical, cognitive, and social growth, especially when she enters into the educational system. Turner syndrome is full of a lot of mights and maybes. Every day, Ashley wonders if her daughter will struggle in life, especially with her education. Mila is a little girl who is beautiful with a long life ahead of her, and with early intervention and collaboration between parents and school personnel, she has the potential for normalcy. What is Turner syndrome? Turner syndrome is when a baby girl is missing the second X chromosome. It happens to every 1 in 2,000 live female births and is the cause of 10% of miscarriages. That missing sex chromosome prevents the body from maturing naturally. Ashley had found out her daughter has Turner syndrome during a procedure called amniocentesis. It can also be diagnosed through a blood test called karyotype. It is usually diagnosed during the puberty years, where you would see the most sexual maturation. It is not passed down from either parent and could not have been prevented. Turner syndrome is named after the doctor who has studied its existence, Dr. Henry H. Turner. In his studies, he noticed similarities of non-maturing girls who were short in height, had short necks, and a low hairline. He continued his observations and provided them with estrogen treatments and saw improvements in their feminization. Here are some common symptoms that they share: short stature, narrow high arched palate, ears protruding outward, webbed neck, droopy eyes, broad and flat chest, scoliosis, flat feet, and swelling or puffiness of hands and feet, especially at birth. Turner syndrome cannot be cured, but with early recognition and growth hormones, these girls can grow to be normal or partially normal height. With the help of hormones, they may grow breasts and even become pregnant. Support and care throughout a Turner syndrome girl's life is necessary for their success. The most common mental and physical health risks are anxiety and depression, ADHD, cardiovascular disease, developmental delays, ear infections, droopy eyes, hypertension, liver problems, skin and nail problems, and thyroid issues. A Turner girl might gain student support depending on the level of need of the child and if the disability impacts access to their education. TS girls may need a specialized gym class with students with other disabilities due to medical problems. Range of motion will be assisted by a physical and occupational therapist. Ashley hopes that Mila's swelling will go down because she wants Mila to be able to join team sports one day. Mila will have to keep up with her doctor visits to ensure great health. She was born with a hole in her heart and enlarged kidneys due to Turner syndrome. Ashley hopes that she won't have to administer growth hormones to Mila, but will adhere to the advice of the doctors. Turner girls are known for having normal intellectual abilities with weaknesses in visual, spatial, executive, and social abilities. A Turner girl may have difficulty in adapting to changes in her environment, therefore having weaknesses in executive functioning. TS girls are known to have difficulty with math problems due to the issues with visual spatial skills, especially geometry. Occupational therapy may be necessary for girls with TS to help with such tasks such as coloring and cutting paper. They may need help of a speech therapist to help them enunciate certain words. Ashley is prepared that Mila will struggle with mathematics and is prepared to have her tutored. She foresees meeting with a speech pathologist because of Mila's high palate, as she may too need help with her speech. She will have Mila assessed for learning disabilities when she attends preschool, and if need be, wants to set up an IEP should she need it. It is very common for girls with Turner syndrome to suffer from shyness, reduced self-esteem, and social anxiety. These social impairments usually happen during the preteen to teen years, where most sexual growth occurs. At times, these girls feel isolated, depressed, and gain anxiety, and may cause a TS girl to respond in inappropriate ways. TS girls may even have problems making friends, and it may be up to teachers and parents to help them along the way. It would be helpful to the TS girl to stay in a general education classroom, primarily so she is able to build her social skills with the opportunity to attend a resource room to gain help with her learning disabilities. Ashley worries that other children will bully Mila because she won't look like the other girls in school because of the lack of natural maturation. Ashley has learned about National Turner Syndrome camp that is held for Turner girls that she wants to send Mila to when she turns 12. So she's a girl so she has girls who are going through the same thing as her to lean on. Turner syndrome falls under the other health impairments category under the IDEA law. Dependent upon the school Mila attends, she may just need time in a resource room where she can build her math skills and speech pathologists to help her with her vocabulary. There's also a chance that she will have ADHD and may need help with adhering to classroom policies. An IEP is a plan for all students who are enrolled in special education programs in public schools. Ashley would like an IEP for Mila after being assessed for a learning disability. She is willing to work with school personnel to set up necessary accommodations for Mila. It is Ashley's hope that with early intervention, Mila would only need SPED during her primary year. As with any disability, it does not define who the person is, it is merely a part of the person's life. Should Mila need help physically, cognitively, and socially, she will have that through her educational career and parents. Turner syndrome will not define Mila's life, and just like a beautiful butterfly, she too will spread her wings and experience the ups and downs of her flight.